Well, I hope you enjoyed that tour of the clinical wound simulation center in Sheridan, Wyoming. It was outstanding. I want to share with you another outstanding piece of information. This section of Peak Performance is going to host one of the internationally renowned wound care experts, Dr. Lee Rogers. Dr. Rogers has co-founded and directs the Amputation Prevention Center at Valley Presbyterian Hospital in Van Nuys, California. And while maintaining an active podiatric practice, Dr. Rogers has found the time to author and publish over 100 scientific papers, articles, and book chapters on health policy and preventing amputation in diabetics. He has been honored with several awards for his work and research. His passion for patient care and limb salvage has expanded beyond his direct sphere of patient contact in Simi Valley to that of a national level. And in August of 2011, he announced his candidacy for the U.S. Congress as a Democratic candidate from California's 25th district. Lee Rogers exemplifies peak performance on a daily basis, and we are honored to have Dr. Rogers join us today on the Wound Wire. Hello, Lee. How are you? And thank you so much for taking time out of your busy schedule to join us on the Wound Wire.
Hey, Jeff. I'm so happy to be here. I've heard so many good things about what you're doing, and I'm honored to be on.
Well, listen. A busy clinical practice, a run for political officer, father and husband. How do you find the time, and where do you find the energy for all of these activities, Lee?
Yeah, I mean, I think any of us who are parents know that the being a father, that takes up an enormous amount of time. But
it sure does, yeah.
It's all about juggling. I've always heard people say, including David Armstrong, one of my mentors, say that if you want something done, give it to a busy person because
That's
they get
true.
it done. And I think that's true. And I've cut into my sleep a bit, but we're managing to get things done.
Well, you bring up Dave, and he's a great guy, and he's I think a mentor to both of us. Certainly, both of us exemplify the things that Dave. Maybe he'll even show up on a segment of Peak Performance. We'll see what happens, but. What I really want to do is focus on you, Lee, here, and what I really want to hear is, my goodness, a successful podiatric practice. You're certainly a well-renowned and respected leader in wound care internationally. Tell us why you decided to run for Congress.
Some of it dealt with healthcare, but a majority of it just dealt with me being fed up. And I think that a lot of people have gotten to the point where you see what people in office are doing, or in most cases not doing, right, and you just get stuck. And I talk to hundreds of people weekly, and a lot of doctors, because we're calling doctors from around the country, and it's surprising to see how people don't really what impact the political arena plays in your medical practice. I mean, just on a daily basis, from things like Medicare, whether or not Medicare covers something, or if you bring products to the market like you do, Jeff, you realize what it is, between a 510K and a PMA process is, and there are some in Congress that want to get rid of the 510K process and make it go through PMA. And having a small business like you do that brings products to the market, you'd realize that that's just not possible. You would never bring anything to market that way. And these are important things that need to be addressed.
Well, you've really been an advocate for our patients, and you've been a strong advocate for especially patients with diabetes. And clearly, there are a lot of victims out there in the current healthcare system. There's been a lot of controversy in this area, Lee. Can you tell the audience, highlight what your goals would be for healthcare policy once you are elected? Now, I'm operating under a premise, Lee, you're going to get that office seat.
Yeah, I talk to people, and this is really good, because a lot of people who have nothing to do with healthcare, patients and constituents, they get the fact there are a few diseases that are costing us a lot of money. They get it. And those few diseases are obesity, diabetes, and cardiovascular disease.
Oh,
and those
absolutely.
three things, they're caused by the same two things, which is lack of exercise and poor diet. And it's those are going to cost us over $2.5 trillion in the next 10 years, those diseases alone. And so if you're really, fiscally responsible, you would say, well, let's put a little bit of money into the preventing really expensive diseases. If you can prevent diabetes by preventing those amputations that occur, or blindness, or dialysis, which is terribly expensive. Imagine what you could save just by doing a little prevention. And prevention is the first thing that gets cut from policymakers and in Washington. And I disagree with that. I think we need to spend more money on preventing these expensive things from happening.
Well, I love those thoughts and ideas, Lee, and I think you're right on the mark. Prevention is clearly something that's been underfunded, undersupported, and hopefully once you get in office, you can make some of those changes. I think those would be very, very important changes. So there's a lot of people out there listening, Lee. We've got a big audience following the Wound Wire. If someone out there is interested in supporting your campaign, how do they get involved? And tell them how they can help you.
Yeah, the easiest way, Jeff, is to have people come on our website, which is LeeRogers2012.com, LeeRogers 2012.com, and they can contribute or volunteer. We have volunteers around the country making phone calls for us, and it's it really makes a difference in whether or not I'll get to Congress. And it's I know it's a lot to ask people. But think about what it would do for your own practice to have somebody there that understands, especially in the realm of wound care, understands wound care and diabetes. And that's really, our goal, to make sure that there's somebody there that knows that.
Absolutely. Well, Lee, listen, I know you're a very, very busy man. You got a campaign to run, my goodness. And I want to thank you once again for your time, precious time given here to the Wound Wire. Hopefully in a few months, you'll find to join us again. But when you come back again to the Wound Wire, Lee, I want to introduce you as Representative Rogers. Doesn't it have a nice sound to it?
Sure does. I'd be very honored, Jeff, and I would come on any time you want me to come on.
Well, listen, please join me in wishing Dr. Rogers the best of luck in the